I'm Luke Schellenberger. I'm an ENT doc. So occasionally little babies are born at the hospital and I get a call because they've got a tongue tie. So what's a tongue tie? So there's a little band of tissue that's between the tongue and the floor of the mouth. So that's called the lingual frenulum. All right, fancy word there. So if that is too tight, too thick, or extends out too far to the tip of the tongue can't move very well. And so a lot of times the lactation specialists the mom will have a hard time breastfeeding, the lactational specialist will look at the baby and say, oh, they've got a tongue tie. And so the most common time I'm asked to see a patient for this is when a patient is, 1 or 2 or 3 days old, extremely young. And doing what's called a frenotomy, clipping the tongue tie, is extremely easy and for oftentimes pretty effective. Now there's been some controversy. Does this need to happen? Will this loosen up with time? And in my opinion, you always have to weigh benefits and risks. And the risk of doing a frenotomy is extremely low. And so for it to be beneficial at all, it has to reach it has a very low threshold to reach to be beneficial. Could we do other things? Could we wait and see? We could, but the problem is, if the child gets a month old, I'm not going to subject them to having to clip that little band of tissue, whereas at only a day or two, they almost feel nothing, and they get back to breastfeeding very, very quickly, and research has showed that, hey, this can be helpful. Whereas after those first few weeks, there's a higher risk of bleeding, higher risk of pain, and I typically would then say, look, let's not do something that's going to subject a 1 or 2 month old to higher risk for bleeding or anything like that. So I see a lot of patients at that age. And then I see some patients who have kind of grown and they've gotten to be 2 or 3 or 4 or 5 years old, or even older than that, and they have a hard time with speech. And so a tight lingual frenulum, what's called Ankyloglossia, that's a word, can lead to feeding issues in a very young child, or can lead to speech issues. And so interestingly, and again, this is just what I've heard, is that in Spain and in countries where they speak Spanish and they roll their R's, like the word for dog is perro, so they have to roll their R's, that they are pretty aggressive on treating ankyloglossia, whereas in the US, we're kind of like, well, we don't roll our R's, so we don't need it. But there are definitely patients who come in and a speech and swallowing therapist will say, hey, this child is having a hard time with their speech. And in those situations, we have to go to the operating room. And so ankyloglossia is not super common. It can run in families. I've definitely seen parents who've said, oh yeah, my girl had it and now my boy has it, and we've all had it. And so it can run in families, but it is also very easy to treat at a very young age. And it's not that hard to treat when children are older, but it does, in my opinion, require a trip to the OR. So there's a little bit more involved when kids get out of that first few weeks of life. So anyway, that's ankyloglossia. That's how we treat it, tongue ties, and anyway, go from there. All right.